Now we start scanning the pelvis of female. Here we see the urinary bladder, which is partially filled. Here we see the debris in the urinary bladder. The wall of urinary bladder is also appears to be thickened. Now we will measure the wall of urinary bladder. The wall thickness is 6.2 millimeter. The normal wall thickness is up to 5 millimeter. Now we scanning the uterus. Here we see the cervix. Here we see the cervix contain a well-defined thin-walled anechoic cyst. And here also we see another small anechoic cyst. These are benign cyst or mucus containing cyst. Now we scanning the body of uterus. And here we see a large polycystic heterogeneous mass. Here we see the posterior acoustic shadowing of this mass. This mass lies in the posterior wall of the uterus. Now on color Doppler we will examine the blood flow in this mass. Here we see that no internal flow is present, but peripheral flow is present. Now we will measure the size of this mass. The mass size is 114 into 92 millimeter. The mass is such large that we cannot appreciate the walls of uterus, and it causes a compression effect on the right lower abdomen, especially when the patient is in lying position. Here we see another heterogeneous mass in the fundus of the uterus. This mass lies in the anterior wall of the myometrium. Here we see the endometrium as a thin line. Now we will measure the endometrium. The endometrium is normal in size, 4.7 millimeter. Now we will scan the blood flow in this mass. Only peripheral flow is present and minimal flow is present in the mass. Now we will measure the size of this mass. The size of this mass is 45.7 into 47 into 8 millimeter. Now we will scan the ovaries to rule out any pathology. Here we see the right ovary, which is normal in size. No mass or lesion seen. Here we see the left ovary, which is also normal in size and no mass or lesion present. The ovary is poorly visualized due to gases. Now how we will write report?